All right, quick update. It's been basically a month since my surgery, and today is a pretty good day. I'd totally forgotten, but you know, you can actually take these off. So a friend of mine pulled these off. There we go, and I'm pulling these off again. So this Hyperfix basically reduces the impact of scarring. Putting a bit of fat there, Julian. Not enough exercise. So there we go. So that's the damage a month post surgery. So I'll get some metho, clean those up on my flabby belly, and otherwise I'm feeling really good. I'm going to cover continence, so I've been working really hard on that. I'm wearing a #1 pad every day, but it ranges from nothing at all, so no leakage overnight or during the day, to between maybe 10 to 20 mils. So, and I'm doing that by weighing the pads 4 times a day. And when I go to bed in the next morning, and that lets me know how much wee has leaked out. So I find it's much harder in the afternoon to hold on, so between say 4 p.m. and 7 p.m. But I'll go into that in a bit more detail in another video. But I just wanted to pull off all of those things, those nasty bits of mucky coverings, and move forward with my life, cancer-free. All right, me again. I've spent about a minute just trying to clean up the wound area. So they actually feel pretty flat. Oops. Oh, by the way, I'm not perfect. It's a shirt for men's mental health. If you think that's refers to the owner, it doesn't. Anyway, so scars have healed up really well. So the stuff that was on them basically softens out the top of the scar tissue, and I just need to work on removing some of that excess flab. Anyway, the other very exciting thing is I'm going to try. I've been feeling so good lately that I'm going to try to jump on my exercise bike. So the great thing about this is if it hurts, a bit of perineal pain, I can jump off straight away. And I think this is really important because one, cycling is kind of my thing, and two, there's a lot of discussion on lots and lots of groups about when you can go back to surgery after having a robot-assisted radical prostatectomy. And I've spoken to the physio that I've done all the pelvic floor work with where I live, and I said, look, is it going to hurt me physiologically? As in, am I going to bust anything? And she said, no, it's just going to hurt you, full stop. So basically, if it hurts, I'm going to stop. It's as simple as that. So I can't damage anything. It just might cause me a bit of discomfort, but I'm going to have a crack and see how I go. Now you'll notice that this is a very wide comfort saddle, and it actually has a silicone topper on it. This is not my saddle. I'll show you what my saddles are like. So these are my weapons of pain. So a standard cycling saddle for my mountain bike and my road bike. You can feel a little bit of pressure there, but it's not uncomfortable at all. So it's been a month, actually 5 weeks since I've been on a push bike. I figured while I'm feeling pretty good today, I'll try some push-ups. All right, they would have hurt a week ago. Would have put a lot of strain on my tummy. So feeling good, it's good.
Alrighty, just want to get out of the wind. 5K's into a very gentle 10K ride just around the local velodrome. Exactly a month since surgery, so feeling good. Only planning on doing 10Ks. See how the perineum feels tomorrow. Sore ass, no more riding. Alright, I don't think I'm going to hit 10Ks because the rain's coming in, but really surprised how good I feel. I hope I'm not doing anything really stupid here. Anyway, too windy to ride, too windy to talk. I'm going to head home, 7Ks in out of 10.
So it turned out to be okay. I got home, no problems at all. And the next day, a little bit sore, and basically I've kept on riding ever since. I find that if I ride for 2 or 3 days in a row, and I'm not talking big rides, maybe 20Ks, 30Ks, something like that, then a little bit sore perineum, but I'm going to work on that over the next couple of weeks, and I'll see how I go. But anyway, big challenges for me, getting on top of the incontinence and getting back to my pre-surgery fitness levels. My whole intent of all of these videos really is to get men out there getting PSA checks and to get over any hurdles you might have in terms of incontinence or horror stories about erectile dysfunction, because believe me, being cancer-free is better than the alternative, which is an early grave. Anyway, hang in there, peeps, and I'll publish more in the next coming weeks or months. We'll see how we go. Anyway, thanks for watching. See ya.